My name's Rich Jennings. I'm the Clinical Director of Crisis and Counseling. 45 years. What an amazing accomplishment. I've only been working for Crisis and Counseling for 2 years, but I've been so proud to work there. I've felt honored over the past 2 years to work with our clients, community, fellow providers, and all the dedicated staff. So what was going on 45 years ago? Mike, you stole some of my stuff, by the way. Richard Nixon was president, right? The Vietnam War was still raging on. Bridge Over Troubled Water was the favorite song, Simon and Garfunkel. Love Story and Airport were the favorite movies of the year. We lost both Jimi Hendrix and Janis Joplin from overdoses, both 27 years old. That's very bizarre, very sad. Alka-Seltzer said, I can't believe I ate the whole thing. I think I can believe I ate the whole thing. Popular sayings were, can you dig it? Groovy, man. And be there or be square. I have to admit, I still use that. My daughter gets horrified when I use it in front of people. She looks at me like I have 3 eyes, and I get the, oh, dad thing going on, right? Postage stamps were 6 cents, bread 24 cents, average income $8,900. The price of gas, 40 cents a gallon. Can you imagine 40 cents a gallon today? I drive this big honking truck, right? I would save so much money, I could fill that sucker up with some chicken, all right? I have to apologize, that's an inside joke. I love me some chicken, right? I love to eat chicken. I eat so much chicken when I hiccup, a boiled egg comes out. I won't tell you where the feathers come out. I'll skip you on that one. And oh yes, in 1970, Crisis and Counseling, formerly Rapid Rescue, opened a teen drop-in center that addressed the spike in drug-related issues in Kennebec Valley on an honorable and needed mission, starting roots in the community, mental health and substance abuse treatment, which we were able to use as a foundation to grow Crisis and Counseling into the agency is today. So we fast forward 45 years, right? Lots have changed, including myself. In the 70s, there was acid rock. Today, acid reflux, right? In the 70s, I was trying to pass my driver's test. Today, I'm trying to pass my vision test. In the 70s, I carried a dime in my pocket to make a phone call. Now I carry a phone in my pocket to make a phone call. In the 70s, a lot of us had long hair. Today, I'm kind of longing for some hair. And Crisis and Counseling has grown in leaps and bounds. We are a $7 million agency with over 120 dedicated staff. We continue to be a well-respected behavioral agency in the state of Maine. We have one of the largest, if not largest, crisis centers in the state of Maine, taking up to 40,000 calls a year, seeing nearly 5,000 clients a year face-to-face. With a robust outreach department and 4 crisis units that served 550 unduplicated clients last year. Excuse me. Our outpatient and mental health and substance abuse services continue to grow, which includes our New Generations program for children and families, and the Maine Mothers Network Case Management Program. We served over 1,522 clients in these services. We have a statewide parent program called GEAR that reached over 6,900 parents face-to-face, by phone, and by email. That's pretty amazing. They do great work. We have an evidence-based jail diversion program called CARA that serves 76 clients. Thanks to Mike Mitchell. It's a great program. We certainly need it. It works really well. Our jail program served more than 1,200 clients that people want to see in jail. Our med management program continues to be busy providing specialized mental health and substance abuse services to over 481 clients. We have a crackerjack group of people. Crackerjacks, that's another 1970 thing going on. Of HR, billing, records, IT, administrative, clinical, operational, and facility management specialists, that are dedicated to our mission. Over the last 45 years, we have developed strong working relationships with our local and state providers, and we are part of a behavioral health home and health info network to help us move towards integrated care. That's a lot. We've done such a good job. I am so proud of that. So what about the next 45 years? There won't be any chicken left. I'll have to eat that, right? There'll be no phone in my pocket. There'll probably be an implant in my head. Don't worry, there's plenty of room in there, so it'll fit, right? So. But this is what I would like to see for crisis and counseling, and how I'd like to see crisis and counseling grow. I would still like to be one of the leaders in the state providing behavioral health services, and maybe in the country. If you don't know that, our crisis center, our services are some of the best in the country. When I go to other services, and I went to the American Association of Suicidality, what we do in the state of Maine is amazing. And when we talk about it, people are like, where are you from? Well, mostly because I say yeah and can't get there, but you know. We have, by then, we'll have met our vision statements of being both the provider and employer of choice. We'll be responsible stewards of the monies we receive. And to that point, we'll be data-driven and outcome-based to show an investment in our company is well spent and will lead to cost savings. We'll have followed current research in behavioral health treatment and developed evidence-based practices and best practices to drive our program. And we will value the importance of development of available high-quality training to help improve our people do the right work. It's amazing how hard it is for us to get the training we need. But everybody's expecting us to do this job without the training. Consumer involvement will be fully integrated, including employment and crisis and counseling. Excuse me. Cultural competency will be weaved through all aspects of crisis and counseling in order to serve all populations effectively and with dignity. A fully integrated healthcare system will be our standard. With parity between medical and behavioral health, we will practice whole health treatment. And what would I like to see from the system? I would love to see an understanding, a buy-in, an investment in behavioral health treatment, and insight around how this investment not only improves quality of life, and that's what we're talking about, right? But also the physical bottom line. Acceptance of whole health as a necessity and best practice. And whole health means the body and the brain. Many years we have separated the both and think that's the way to go, and it just doesn't make sense. A mandate that medical, nursing, social work, and counseling schools provide significant curriculum around behavioral health treatment and suicide risk assessments. Many states already have this. We are undertrained, we are undereducated. When I got my master's degree, it was very little about mental health, none about suicide risk assessment. We are never going to affect change unless the institutions of education change. Standards of assessing suicide risk in both behavioral health and medical practicing that follow current research. We save many lives a day. It's amazing what we do. And unfortunately, national suicide rates still go up. That is so frustrating. There was a study in California of middle-aged white men, a high risk factor for suicide, that died by suicide. 70% of those men had seen their PCP within 60 days. 60 days, and we didn't catch it. People are dying. We need to be so much better at this. We really do. Stigma needs to end. People should be able to get services and not feel like there's repercussions. If you had a stubbed toe, if someone's going to be mad at you that it hurts, no, we got to stop if someone has a symptom. People need to accept that, and that's part of just another symptom. We have come a long way, and we still have a long way to go. But CNC is up for the challenge. And we also see it as a responsibility to our clients and our community. Thank you very much.